The audit team sits within the Quality and Safety Directorate. In short, clinical audit answers the question, are we doing what we should do in the way we should be doing it? Clinical audit is concerned with improving the quality of healthcare that the NHS provides to its patients. It's a way of working together using research evidence to measure and improve the quality and effectiveness of our care. In brief, it provides a method for systematically reflecting on and reviewing our practice. A standard represents best practice, and this may be agreed nationally or locally. Standards may be based on guidelines, those from NICE or the professional bodies, on systematic reviews or consensus with peers where there is no available evidence. There are a number of reasons why clinical audit is an important activity. The main reason is that it helps to improve the quality of the service being offered to our patients. Without some form of clinical audit, it is very difficult to know whether you are practicing effectively, and even more difficult to demonstrate this to others. You must first contact the Trust Clinical Governance and Audit Department or your audit lead to establish which audit projects the Trust has listed as priorities for the coming year. Your specialty-based governance facilitator will give you a project plan which you'll need to complete beforehand. The project plan is one of the most important areas, as this will form the template from which your audit will be run. This should be the first stage on the road to a successful audit. Your clinical governance facilitator can assist you with designing a data collection PROFORMA. Most NICE guidance audits will have the recommended audit tools available. More information on this can be found on the NICE website or via your governance facilitator. In general, between 30 and 100 sets of notes are reviewed to ensure that the results are robust and meaningful. Clinical audit must always be conducted within an ethical framework ensuring patient confidentiality at all times. Speak to your clinical governance facilitator for help and advice on how best to analyse your data. For all trust must-do audits, the facilitator will do the analysis for you. All national audit projects have dedicated teams of people that undertake the analysis. Alternatively, you can undertake analysis of your own data. Once your data has been analysed, contact your clinical governance facilitator and audit lead to arrange a date to present. This should be at a clinical governance audit half-day meeting, medical clinical group, or other appropriate forum. A summary of all projects, including local audits, will be produced by the project lead or auditing clinician after presentation and must be included in the relevant quarterly audit report to acknowledge audit activity. You must include a detailed action plan in your summary if appropriate, which will be followed up accordingly by the clinical governance facilitator. Smart action plans should be devised once the audit is complete, meaning actions are specific, measurable, attainable, relevant, and time-based. To complete a full audit cycle, a re-audit needs to be initiated to ensure that any recommendations have been put into practice and that standards are being fully met. It identifies and promotes good practice and can lead to improvements in service delivery and outcomes for patients. It can provide the information you need to show others that your service is effective and cost-effective and thus ensure its development. It provides better opportunities for training and education. It helps to ensure better use of resources and therefore increased efficiency. It can improve working relationships, communication and liaison between staff and patients, and between different agencies. The aim of clinical audit is to improve patients' outcomes by improving professional practice and the general quality of services delivered.